get up, I get up. I should lose a focus, come on, be a good get up. I shouldn't gonna stay focused. Opportunities, gotta get this, gotta fight this.
Sanibonani lapha emakhaya and salute to all my hustlers. Sinangele qepheni sithi sokuqala ke se 50-50 la simkhombisa zonke inhlobo ezihlukahlukene zezilwane ezincane nezinkulu ezinoboya nezinezikhuba. Ngiyadlala bafethu uTuesday bafethu ngo2 o'clock without failure iSpani sikubona ukuthi igama umekumele lishuma kodwa ngithanda ukuxwayisa ukuthi ngizobona izilwane eziningi namhlanje njengoba ke simkhombisa umkhakha weveterinary science bafethu sambona hasa lethu uJaco Viljoen. Insizwa ithi yona sidala ke iloko ifunde kodwa manje sezilungiselela ukuthi ingasebenza ithi ithanda izilwane ithanda nokuzilapha. Coincidence? I think not. I also love animals, especially your incident kitten. So cute. But it's not about me, it's about him, so let's check him out.
I was playing rugby and I got a very hard knock to my head. One of the nerves were damaged. So I essentially had a skew eye. That changed my whole life. People were laughing at me because you're a skew-eyed person now. I was very fortunate, to grow up in a family, where my dreams were supported. So I had a good bunch of friends that were always driven. We had a balanced lifestyle, and I was very lucky in that sense. I think I won the friendship lottery.
We met through mutual friends. So we met twice before we realized we've met. But we went on a hiking trip together, a group of friends, and then we just clicked and we spent all the time on the hike together, and we've been together ever since then.
So I was a very active student. I played a lot of sports. I was crazy about sport. I played rugby, cricket, tennis, squash, golf. So something that happened to me when I was 16 years old. I was playing rugby and I got a very hard knock to my head. One of the nerves that support one of these muscles causing your eyeball to turn outwards were damaged. So I essentially had a skew eye. So immediately that changed my whole life. I couldn't catch a ball because you can't judge the depth of the ball. So, I had a choice. I had a choice to either tell my parents, you know what, I'm gonna quit everything. I'm gonna stay at home, do homeschooling. I don't want to face the music. I don't want to face the people outside because of my skew eye. I chose not to have a victim mentality. Because if you, in life, I believe if you're faced with a problem, you must learn to channel that energy. You must channel it in a solution. And, I started exercising my eye a lot. And I remember one morning, it was 6 months after the injury, I woke up and my eye was the nerve was starting to connect. And it wasn't long, it was a few weeks, and my eyes were back to normal. Everybody is faced with problems. If you can learn to channel the energy, the fear, say you're faced with a problem, the fear that you feel, to allow yourself not to be boxed in by fear, not to be boxed in by negative emotions and negative people in your life, and you can take that energy and channel it into a solution.
I definitely think Jaco is the kind of guy who would be a good husband and father. Just the way he is with me, and Stella is very responsible, very reliable, so I never have to wonder what's going on or where is he or anything like that.
Moving from primary school to high school, I think it's like any stage in life, you're going up a notch. So it was more challenging for me, all around, now the pool is a little bit bigger. So in terms of sports, it was more competitive. I remember grade 8, you starting with algebra and those type of things, definitely was challenging. I've always wanted to be a veterinarian. But I was in a group of friends that all of them wanted to be doctors and dentists and things like that. So when I reached grade 8, it's time for us to choose our subjects. So I chose accounting, and I had math, science, accounting, biology, and then Afrikaans and English. So initially, the plan always after matric was to go and study. Yeah, so I did the BSc degree, so they select you on your second year marks, and I took my second year marks, and I was admitted to Hustler Jaco, the Faculty of Veterinary Science at the University of Pretoria at the main campus, and I was very happy. I completed my first degree, which was the BSc Veterinary Biology in 2007, and then the second degree, which is the BVSc Veterinary Science in 2012. So after I qualified, I stayed in Pretoria, but I started out working in Johannesburg. I then moved back to start working in Pretoria. I'm currently doing my honours. It's the veterinary science or the BVSc honours at Hustler Jaco at the University of Pretoria. So we'll be finishing up with that qualification at the end of this year.
When I realized that he loves animals, it's definitely a bonus. I don't think it would have been a deal breaker, but I also love animals, so it's a shared interest.
Tomorrow I'm going to Greenside Animal Hospital for my second interview. It will be a working interview where they will basically assess my day one competencies, and it's going to be more of a practical approach to interviewing me.
I would want to tell him to just relax and be himself, because his personality is one that people can easily see is kind, and he doesn't have to worry.
If I get the position at Greenside Animal Hospital, it will mean a lot to me. One of the benefits of getting the job will mean that I can move to Johannesburg to be with Millicent. But mostly for me, it's about getting the opportunity to work with a great team at Greenside Animal Hospital. I think it might be seen as a weakness, but I try to work as best with that as I can.
Any other weaknesses?
Ek is vandag hier by Greenside Animal Hospital. Ek gaan nou begin met die praktiese gedeelte van my onderhoud. Ek is 'n bietjie op my senuwees, maar ek voel redelik goed. Kom ons kyk hoe gaan dit.
Jaco, welcome to Greenside Animal Hospital today. We're very glad that you could join us for the interview. Greenside Animal Hospital is a practice that was established in 1943, and it's one of the oldest veterinary hospitals in the country. And we're associated with two other veterinary hospitals, London Vet Clinic and Burnham Vet Clinic, and we are looking for a vet to go and run the Burnham veterinary practice for us. So we would like to interview you today and find out who you are and whether you'd be suitable to do the job for us. I'm Dr. Jaco Viljoen. I'm the Managing Director of the group, and with me today is Trish, our HR Manager, and we'll be asking you some questions.
So we're going to start off by just asking you to tell us a little bit about yourself, your background, family, hobbies, interests, just who you are as a person.
I was born and bred in Welkom in the Free State. I was raised in a humble but loving home, and it's from our parents that I got my love for animals. So we had dogs, cats, chickens, fish, and my dad's got an African grey. So I was exposed to a whole array of animals, and it's been since a very young, tender age that I knew that I wanted to be a veterinarian.
Jaco, if you get the job with us, you'll be working without supervision, direct supervision in a veterinary practice, running this veterinary practice for us. So what would you do if you were in a situation where you battled to make a diagnosis, or where you found it really difficult to get a diagnosis? We all know dogs and cats can't talk, so it's not easy to often make a diagnosis. What would you do?
I believe it's important to take a proper history before you start working up a case. To do get the basic clinical parameters, do a blood smear, and from there do extra diagnostics if you still don't have your answer. Things like ultrasound, radiography, full blood count, all the bloods that you need to do. If you still can't make a diagnosis, I think it's good to speak to one of your colleagues. It's just an extra pair of eyes.
So there's a lot of vets out there, and most vets qualify from the same veterinary faculty in South Africa, being onderstepoort. So if we were to appoint you, what are the 3 top values or skills you think that you would be able to bring to the table?
Yeah, so for me, I've written an aptitude test called Strength Finder. So I've written a few, but I highly value Strength Finder, and my 3 strengths basically, which is in the top 5, is responsibility and focus is one. And then I think what you can expect is a hard-working person. So a hard-working, focused, responsible person is how I would sum up myself. Yeah.
So Jaco, it's great to know your strengths. Do you know your weaknesses by any chance?
I think one of my weaknesses is that I can be a bit slow at times. I like to think a lot about things and think a case through properly. So often, when it's very busy, I feel that, sometimes, it's taking a little bit too long, but that is just part of how I work, is that I like to take my time, I like to do things properly, and I think it might be seen as a weakness, but I try to work as best with that as I can.
Any other weaknesses?
Can't really think of one right now.
My weakest point is the fact that I've got very few weaknesses.
Multitasking, I can't multitask. Yeah, okay.
Jaco, we'll be moving over now to the practical part of your interview, so thank you for your time in this interview. The clinical competency tests that we'll be doing will be monitored by my partner in the practice, Dr. Hustler Jaco Viljoen. who will mentor you in this process and do some assessments and see how you do in these tasks. And then at the end of the day, we'll get back together again and we'll see how it goes, and based on the outcome of that, we'll take the process forward.
Okay, good luck.
Thank you very much.
Mahaslas, pele le ka kgetha career, sheba ditakatso tsa hao ho tloha bonyaneng le personality ya hao. Ha ile ya ku yena, o kgethile hantle. Ke kgale a o etsa mosebetsi ona ene o ikemiseditse ho ikemela le ho etsa sena a le mong. Ha ekaba o batla ho tseba ka tsa dikwetliso, di teng di-institutions le di-associations tse kwetlisang lekala lena. My Hustler, sengwe le sengwe se o batlang ho ba sona, o ka ba sona, ha wa thibeleha. Se o thibelang ke se leng ka hare ho mohopolo wa hao. Ha fela wena o na le lerato la diphoofolo le tsa maphelo, monyetla o teng ha o ikemiseditse fela ho tsamaya tsela. Tseba gore toro le maikemisetso ke tsona he tse isang katlehong. Ene for wena ha ho lata ho ba se no tlamile ho ba sona.
I need lunch. My name is Dr. Suzette Groebel. I'm a veterinarian at Greenside Animal Hospital. I qualified from the Faculty of Veterinary Science at Victoria University in 2001, and I've been employed at Greenside Vet since 2003. Today I'm going to be Dr. Jaco Viljoen's mentor.
Who let that dogs out? Who? Yes, it is Zinja. Hamakati. Ngizokutshela ukuthi ubani ke odedele zonke bafethu. Uyena ke uYaku bafethu. Insizwa ke veterinary science graduate. Njengoba ke anethemba ukuthi angatholela umsebenzi khona lapha at Greenside Animal Hospital. Njengoba ke insizwa ifuna a full-time practice position bafethu. Insizwa kuzohamba lapha ke iyolanda umlando. Iphinde futhi ithatha ama-tissue samples ku-patient yakhe yokuqala. Kodwa ngaphambi ukuthi asebenze. Ngithi lapha emakhaya bafethu nayi ke into engathi ngiphethe kabuhlungu. Iyona ke i-word jumble. Amagama ke alandelana kanje u-I no G no E. Moyazi impela ungena lapha na ku-Twitter na ku-Facebook. Kodwa khona manje sami sokubona ke insizwa ishaya i-task yakhe yokuqala. La ke izonceda ke i-fairy friend yethu bafethu which is in trouble trying to pull a rabbit out of the hat. Asimbona ukuthi uzosebenza kanjani.
So Jaco, we've had a client come in. I would like you to start with the performing of task 1. Task 1 will entail introducing yourself to the client, getting them into the consult room, taking a full history, and then I would like you to start with a physical examination of the patient, do a full physical examination, and also do a rectal examination for me, and a blood glucose test.
She's losing weight, but yet she's eating so much.
Yes.
Yeah, she's drinking a lot of water. Yeah, I just want to have her checked out.
Any vomiting or diarrhea?
No vomiting, diarrhea, nothing, but she is constipated.
Does it?
Yeah.
So she's struggling to pass a stool?
Yeah.
Okay, well that's 100%. And for how long has it been going on now?
Oh, for about a few days now.
Okay.
Yeah, but the losing of the weight has been about a week or so.
Okay. So she's drinking a lot of water. Is she urinating a lot?
Her usual.
Is it? Okay. 100%. I think what we're going to do is we're just going to start with a basic clinical examination. Just starting from the nose, ending at the back. We're going to test her blood glucose and do a rectal examination, and then we can take it from there. Okay. 100%. So die emosionele kant van veeartseny wat ek van hou is die feit dat mense lief is vir hulle diere. Dit is my lekker om in 'n omgewing te werk waar mense dieselfde passie as ek het vir diere en om weet 'n omgewing te wees waar mense omgee en waar ons 'n verskil kan maak in diere se lewens.
Jaco, and in general, how do you feel about South Africans as pet owners? Do they treat their pets well? What has been your experience?
In my experience, people in South Africa absolutely love their pets. Most of the clients that I see, the pets they're treated as children in the house. So I think you're going to get a part of a society where animals are abused, but I think for most part, animals are treated very well.
I feel that there's not a lot of veterinarians in South Africa. We only have one veterinary faculty at the Onderstepoort at Victoria University, so there's not a large amount of veterinarians that qualify each year. So yes, we do have a shortage in this country, and especially the rural areas take a lot of strain in this area because a lot of the vets are concentrated in the cities. Jaco, so why are you checking Taura's ears today?
So I just want to make sure that I can see the eardrum. Just want to make sure that there's no infections in the ear. It's all part of the minimum database, just to make sure that we're doing a good general examination. Ek dink die professie het nog ons 'n redelike pad om te stap, jy weet, en om al die volke en al die tale te verteenwoordig. Ek dink nie almal het noodwendig blootstelling aan veeartseny soos wat ek gehad het toe ek groot geword het.
I chose eventually to work with companion animals. When I started out as a veterinarian, I did a lot of mixed practice. I did some locums where I did large animal work, some cows and sheep and goats as well. And then eventually I met my husband and he lives in Johannesburg. So as much as I enjoy the large animal side of it, I've settled in small animal practice.
Temperature is nice and normal, there's no fever, so that's very good news. Okay, that's excellent. So I think what we want to do is we want to make a blood smear and also test our blood sugar levels. And I think a rectal examination as well, just to confirm the constipation. So you can feel there's a little bit of hard stool here. Is she getting any bones to eat? Possibly no bones. Okay. No, you can definitely feel it's a bit hard, but the stool is a nice normal color. So I think what we will do to confirm the constipation is to take an abdominal radiograph, just to see what the extent of the constipation is. Die eerste task one was baie goed geweest. Ek dink ons het 'n redelike goeie geskiedenis gekry. Ons het 'n goeie minimum database bymekaar gesit. Ons kon vasstel wat fout is met die dier. Jy weet, en ons kan daai dier nou behandel. So ek dink die uitkoms was goed.
You've done your clinical examination, you've done your blood glucose levels, your blood smear and your rectal examination. I think we now need to proceed to task 2, which would be the abdominal x-ray, as well as the evaluation of the blood smear. So we will be taking Tora through to the back of the hospital so we can continue the evaluation there.
Excellent, 100%.
Jaco o supile interaction e ntle mokuding wa hae le ho monga yona. Hlokomele le lerato la hae la iponahatsa. Tsebo ya hae ya tsa meriana e a ipuella. Bongata ba di-vet ba sebetsa ko di-practice kapa ba rana di-practice tsa bona. Bona mosebetsi wa bona ke go thibela mafu a diphoofolo, maele ka tsa dijo, hlokomelo le hlaho ya diphoofolo. Ha o le vet o tlameha hore o rate diphoofolo, o rate lerato la tsa science, o di hlomphe ene o rate go sebetsa le tsona. Mahasla hangata ke tsona ditsela tse thata tse ileng hore di ho isa pallong e kgethehileng.
Okay, Jaco, we're ready for the start of task 2 now. I want you to stay in the blood smear that we've done on Tora just now, and then we'll go and evaluate that.
Yes.
And then after that, we will proceed to the X-ray room where we will be taking the abdominal radiograph of Tora to check for constipation.
Okay, that's
Okay.
100%. Sit up. Okay. I'm just going to leave that in for about 8 seconds.
Can you explain to me what you're doing there?
So I'm just putting the blood smear in a fixative here. It just allows the cells to basically stick to the slide, and yeah, it doesn't need a lot of time.
The animals that I have the strongest bond with would be both cats and dogs. I like different aspects of both of them. I love the independent spirit of the cats, the fact that they do things on their terms, and that they're so graceful to watch. And dogs, that unconditional love and that happiness to see you when you get home after a very long day. There's nothing that beats that. So Jaco, I know in veterinary science we work long hours, but do you get any time for some hobbies?
Yes, yeah, I like to relax with friends. You know, if I get a chance, try to maintain good relationships. And then we love to go running. We love to do the trail running. And yeah, apart from that, just reading. So ek het 'n troeteldier. Sy bly nie by my nie, sy bly by Millicent, my meisie. Ek en Millicent is nou so 3 jaar wat ons saam is, en ek het Stella al herken toe sy 8 maande oud is. So ou Steltjie ken ons nou al vir 'n hele ruk. Sy is 'n whippet. So dis maar eintlik soos 'n windhond, maar net 'n klein windhond. En sy's baie lief vir haar.
Jaco, I think that smear is perfectly stained. Let's leave that to dry for a little bit.
Okay.
Then we're going to proceed to the X-ray room to do the abdominal radiograph of Tora,
Yes.
where we'll be putting on our protective gear first before we proceed through with the X-ray.
That's perfect.
Okay.
excellent.
Thank you.
Okay.
Good. Let's move. Okay. Task 2, there could be many challenges. If your blood smear was not performed correctly, you could not have a good picture. Jaco, we finished doing the X-ray now. If you can please pick up the imaging plate for us and put it in our developer, then we can have a look at the image in a few minutes. Thank you.
So die dier waarvoor ek die bangste is, sal 'n slang wees. Ek sal raai ons binnekoppe. Ek sal 'n slang, ek het al 'n call-out gekry om 'n slang te gaan vang by iemand se huis. Ek kon redelik sien dat dit is 'n breinhuisslang en ek het hom toe gevang, ek weet soos die crocodile hunter met my stok en die stert. Maar ek dink nie ek het genoeg ervaring om 'n giftige slang te vang. So ek dink as dit 'n giftige slang is, sal ek eerder dit nie doen nie. Maar as hy nie giftig is nie, sal ons hom vang.
Okay, Jaco, I think that view is absolutely perfect. I think if you can remove the imaging plates for us and place it back on the table, then we can do the next view, and then we can finish up the radiographs. Jaco, are you the first veterinarian in your family, or is there a whole horde of you guys in the family?
No, I'm the first veterinarian. I'm my mother's favorite child. You know, she's very proud of me.
The one thing I would wish for people to consider before buying a pet is that they can actually care for the pet. That they don't just buy the pet for the sake of having a pet or because of the novelty's sake, but that they have the means and the environment to care for the pet.
So I'm going to be performing the cystocentesis now. I'm just putting the probe on the abdomen with that little part facing to the left.
I think that brings us to the end of task 2. We've got a nice urine sample. We can go and analyze the urine sample, look at the blood smear, and then we can get back to the client about Tora's condition and see if we can confirm their diabetes. So I think we will be finishing with task 2 now, and then we can move on to task 3, which would be a surgical procedure where you're going to be performing a castration.
Excellent.
Thank you.
Mona re bona bokgoni ba go interpreta le go analyza ditlamorago tsa x-ray, bokgoni ba go supa bothata le go kgona go tla le tharollo. Dintho tse kgotsofatsang ka o ba vet kore o sebetsa ka diphoofolo o phete o sebetse le ka batho o thusa diphoofolo o na le monyetla go specialize ka phoofolo e itseng kapa diphoofolo go ya ka o fapana empa o sebetsa di-hour tse telele o sebetse le bosiu ene hape o na le bokotsi ba go thona ka mafu mahaslas bophelong go go nyane fela go etsagalang go wena go go ngata ke tsela e wena o arabang kapa le diketso tsa hao.
What came before, the egg or the chicken? I don't know. Like, why did the chicken cross the road? I don't know. Probably iyagula if you want to vet uyagula pan. I don't know. What the nyazi to insizwa yethu bafethu injengo Dr. Doolittle. Get it? Iyakwazi ukukhuluma nezilwane, iyandastela ukuthi zikhula kuphi incede. Anyway, let's leave that. What is the word jumble? I don't know. Kodwa ke nginikeza another clue which is the letter N. Boyazi impendulo ngena lapha ku Twitter na ku Facebook. Ngithi imiphumela seyiphumile insizwa emva kokhefu iyongena lapha ku surgery bafethu izama ke ukulapha isilwane. Whoa, guys, whoa. I just remembered, I have a dog I haven't fed. More still to come after the break. Snoopy, fetch! I hope he comes back, but I'll be back.
Jaco, we are now ready to proceed with task 3. We are going to be neutering little Bovril here. So I would like you to do a full pre-anesthetic check for us. Start by weighing him, full clinical examination. Then we will be putting him under general anesthetic,
Yes.
and then preparing him, and then we will take him through to theatre.
Okay, that's perfect.
Okay.
Do you mind helping with your holder?
Sure.
Thanks, boss.
Jaco, you told me that the dogs are your favorite, but how do you feel about your cat patients?
So cats are very special in their own right. They have a little bit of a different personality, and one approach them in a different manner. But they are still companion animals, and also very close to my heart.
Okay. Have you ever owned a cat?
Yes. Yeah, as a child, I've had about 3 cats. One Siamese, one Persian, and one domestic short hair, black and white.
Just a moggy.
Yes, yeah. Yeah, he was a little rescue. He came to our house, just pitched up there, so we took him in, and yeah. Ja, so ek dink op skool ek het maar soos ek kan sê die bullying bullying. Ja. Ek het dit maar gevat soos dit gekom het. Ek het 'n redelike goeie ondersteuning in my huis gehad. Mense het my nie noodwendig toegelaat om myself jammer te kry nie, maar ek het aangegaan soos normaal. My ouers het ons gehou soos wat dit was. Die oog is iets wat ons geglo het gaan regkom.
I think in veterinary science, sometimes for us veterinarians, it's more difficult to deal with the client because we love animals so much, so we love working with the animals. And sometimes working with people can be a bit more of a challenge. Okay, Bovril, okay.
So I'm just going into the muscle here. Good.
I know.
Intramuscular injection, give him. It does sting a little bit.
Yes.
But we're just going to give him a few minutes just to relax. And,
Okay, he's a very brave boy.
So die verskil in jou post-operative kan ek sê herstel na die operasie in klein diere versus groot diere is maar met iets soos byvoorbeeld perde, hulle herstel is baie hoë risiko omdat hulle groot diere is, omdat hulle baie rondval, is die kans groter dat hulle self kan beseer.
I think let's see if we can get some local anesthetic into that little throat of his. Perfect. think to proceed with task 3, can you go and scrub for us and prepare yourself aseptically?
Okay.
Then I will look after the patient in the meantime and bring him through to theatre for you.
Perfect. Thank you.
Okay, thank you. In task 3, the challenges that Jaco could find during surgery, obviously the anesthesia of the patient, getting the patient to have the correct anesthetic depth, that the patient don't wake up during anesthetic. Let's proceed with task 3 then. The castration of little Bovril here.
Okay. I'm just going to proceed with the cut in the first scrotum.
Okay. Jaco, are you still as nervous doing surgery as the first time you did surgery?
No, I think the more you do it, your hands become accustomed.
The patients, I just need to change the anesthetic level quickly. Yes.
Why?
He's a little bit awake. He's not awake, but he's just he's a little bit too light. We want him in a deeper plane of anesthesia.
Switch.
Okay.
Okay. So that's the procedure complete. No sutures or anything for the scrotum.
No sutures for the scrotum because it's just too irritating, and otherwise the cats would just lick all the time. There we go. I think let's wake little Bovril up.
I'm just quickly going to unscrub and get the reversal so long. Okay. Excellent.
The one thing I would like to say to Jaco if he gets this job is keep up the good work, be as thorough as you are. He's really meticulous in everything that he does, and I think that's an excellent trait.
Okay, cool. Let's cut it and go to the much more lighter.
Jaco, how did it go?
I think it went well. All of the tasks, were handled successfully. Everything from the X-rays to the cystocentesis, the cat surgery, the neuter went well. So I think overall it was a success.
Are you comfortable with how things went?
Yes, yeah.
What for you was the most challenging of the 3 tasks?
I think the surgery, getting the anesthetic and the surgery done perfectly. Out of all the tasks, the surgery carries the most responsibility. So I think in terms of challenge, that was the most difficult.
Jaco, we had a discussion with your mentor for the day, Dr. Suzette, and she had a few remarks about your performance today. Before we talk about an appointment, is there anything that you would like to ask us?
I would, at this stage I'm doing my honours, and I was wondering, should I get the job, would you be willing to accommodate me to go to class at Onderstepoort because sometimes, you know, I have to be there for the whole day. So that was one of my main concerns.
Jaco, at Greenside Animal Hospital, we're very keen on people developing themselves, and the group with Linden Vet Clinic and Burnham Vet Clinic is part of our aspiration to be one of the best veterinary groups in the country. So we strongly encourage our staff to better themselves and to advance their professional careers. So we're very positive about people who study further, and on that score we would definitely, I'm sure, be able to make a plan to accommodate you so that we get some of the vets to work in some of the shifts that you would have to have worked in to be able to further your studies and finish your degree at Hustler.
Thank you very much. Thank you.
So Jaco, after discussions with Suzette and with Dr. Jabe as well, and seeing your performance in the tasks that you performed, I'm very pleased to be able to tell you that we will be offering you a job at Greenside Animal Hospital, but working then at Burnham and running that practice. So congratulations.
Thank you so much. I'm so pleased. Thank you very much. Thank you. Thanks. Thank you very much. Thank you.
Jaco, congratulations on getting the job. We're very glad that you're going to join our team and looking forward to it. And Trish will be in touch with you in the next few days to get the paperwork sorted out. And if all goes well, you'll start with us on Monday.
Excellent. Thank you so much. Thank you for giving me the opportunity. I really appreciate it. Thank you.
Ek het sopas my onderhoud hier by die Greenside Hospital voltooi. Ek het baie goeie nuus gekry. Hulle het my aanvaar, ek het die werk gekry. Ek is regtig baie dankbaar en ek is so opgewonde want dit gee my die geleentheid om meer ervaring op te bou en om meer te leer onder goeie mentors, en ek is net so oorsteld en baie dankbaar. To all my hustlers, Pressure, Pusha, Panda. Peace out.
Well done, Jaco. Re ithutile ka wena gore re tsebe go gola, re tlameya go nka mehato e leng ka godimo go rona. Re tswe mo re ikutlwang bonolo. Potso ya rena ya beke ena e tswa go Thandeka. A rena o na le kgatlhego ya go ba auditora. Hopola gore o tlhoka pure maths gore o kene le degree ya auditing. Di auditora bona ba netefatsa gore di company di rana ka tshwanelo. Ba sheba gore ba patala tax and ba ipatala ka tshwanelo. Ba sheba di financial statement le go netefatsa gore di financial statement tseo di bua bonnete. Ha e ka ba hona le go sa utlwang, hopola o checkela Facebook ya rona kapa yona website ya rona. Ke emetse ya hao potso.
Baso bani mahasda biza zonke izinja zabo ngiyakutshela without failure bafethu ama-hustles ala ekhaya ayishaya iSpani aphinde futhi asithole bafethu ukungigqugquzela lapha emakhaya phinde futhi kunikhombisa ukuthi azi mfethu mangafaka inhliziyo yakho nengqondo yakho ayikho into engakuhlula okuyinto ke yenzo uyakho nje basimalaseleke emsebenzini wakho omusha. You know it's a dog eat dog world out there, and Jaco just took a big bite, but for right now it's because ukuthi manje nginikeze your word jumbo igama kathi sifuna yi-diagnose. To simply put it, is to be nosy into other people's businesses. Uma kuyitholile sihalala kuwena, uma ngayitholanga asihlangane nje next week. Ngihlala ngitshela ngithi asihlangane khona lapha enkundleni zokuxhumana bafethu, Twitter, Facebook and YouTube. Mina ngihlala ngitshela ngithi don't look down, look up and stay up and release the animal in you, the beast in you. Peace.